So welcome everyone to today's session. My name's Sally Leach. I'm from Henpicked Menopause in the Workplace and absolutely delighted to be running today's session. And we're really delighted to be joined by Dr. Liz McCulloch from Hormone Health to talk about menopause and the impact it has on our bodies. And just to introduce Dr. McCulloch, she started her career in Austria. She graduated from Vienna University and is trained in Obstetrics and Gynaecology in one of the most reputable clinics in Vienna, and then decided to move to the UK and gained her GMC qualification as a General Practitioner, as well as training with Nick Panay, and also working with the menopause department at Chelsea and Westminster Hospital. Dr. McCulloch is a member of the British Menopause Society and the British College of Aesthetics, if I can get my words out, Medicine, and currently the Deputy Chair of the East Sussex Medical Committee. So Dr. Liz, welcome to today's session. And just to kind of start off today's session, just really wanted to talk in general, because we hear from many people in our sessions that menopause is having a really big impact on their bodies. It feels very different. What are some of the key ways that menopause may affect our body and the changes that we might see?
Hi, Sally. Thank you so much for your introduction and thank you for the invitation. It's really a pleasure to be here today. So today we're going to focus on the menopause and its effect on the body. So we're not going to talk about the vasomotor symptoms, so that's the hot flashes and the night sweats. And we're also not going to talk about the emotional symptoms that you may experience during menopause. This is, something for maybe another webinar, and we've talked about this in the past. So today we're basically just focusing on body effects. So firstly, you see changes to the cardiovascular system. And when you go through the menopause, you have a higher risk of osteoporosis later on in life. You see changes to the vulva and the vagina. So the vagina, the
Sorry, I think Dr. Liz is just frozen for a moment. Just bear with us for a moment. We will just see if we can get connected again. So apologies, we're just going to pause just for a second, just while we get connected back to Dr. Liz. She's just left and she's just rejoining. And what she was just really talking about just in the introduction there is the fact that menopause can have a lot of different impacts on us physically, and in particular those huge changes. And one of the other things that she was just coming on to talk about, which we know we get asked a lot about in our sessions, is around the impact it can have on our metabolism, on our weight. And we're going to talk in that much more extensively as Dr. Liz joins us back in a moment, because we do hear those questions from many people, in particular the frustrations around having or doing the same thing as they've always done, and things feeling very different and not having the same impact. So I think that's a really important thing for us to recognize. So I'm just going to pause just for a moment while I just see if we can just get Dr. Liz back on, as she's back here now. Perfect timing. Hi Liz, can you hear us?
Looks like she's still frozen, Sally, doesn't it? For me too. Oh, here we go.
Hi, Sally. I'm so sorry.
That's
Can you hear me?
Yeah, we can hear you now.
Okay, sorry. What's the last thing you've heard me say?
You were just talking about the impact that menopause can have on the vulva and the vagina in terms of the body changes. Okay,
sorry, my internet dropped out, unfortunately, at the wrong time. So apologies for that. So the menopause can also have an effect on the ligaments and the joints. So what is known in the UK as frozen shoulder, in Japan, it's called the menopause shoulder, because the peak incidence is during the menopausal age in women. Many women complain about hair loss, that the hair becomes thinner or they're losing hair. And it's known that during the menopause, there is an acceleration of the aging of the face. So the fat compartments can shift and the skin can become thinner. And very annoyingly, we see a tendency to gain waste around the middle. So central fat accumulation.
Yeah, absolutely. And that's what while we were just waiting for you to come back, Liz, we were just talking about, because weight gain in particular, it's something we get asked a lot about in our sessions. And why in particular during this menopause transition can that have an impact on our weight? So I'm just checking, Liz, did you hear that question?
No, sorry, I heard it can have an impact. Did you mean about impact on weight?
Yeah. Why is menopause affecting our weight?
Okay, so that's a very interesting question. So is it the menopause that's causing the weight gain? Is there a weight gain at all? Or is it the aging that causes it? And who's to blame? Is it the HRT? So many times women say, Liz, I'm eating less, I'm working harder in the gym, like I'm doing everything I used to, but even better. And I'm still, the weight sticking to me. And that can be extremely frustrating. So what can you do to, why is that? Is it the aging? And we know that weight gain is a major health concern. It can also have an impact on our self-esteem and our social functioning. And Sally, as you know, obesity is also the biggest risk factor for breast cancer, much more so than that slight increased risk that we see with HRT. And so in the menopause, we see that there is an increase of body fat over the whole body, but especially around the waist, the middle line. And we see that there is, women tend to gain about 0.5 kilogram of fat per year. And this is due, some studies say that this is due to aging rather than the menopause itself. However, during the menopause, we also see metabolic changes. So we know that the central fat metabolism, the fat metabolism, adipose tissue metabolism changes. And if you want, I can talk a bit more about what the changes are within that metabolism so that we understand why we're gaining the weight.
I think that would be really helpful to understand, because a lot of people do ask us, why does this happen? So understanding what's happening to our metabolism during this change, and in particular then what we can maybe do to help to manage that. Yeah,
sure. So it's really hard to break the cycle. So when we eat carbohydrates or sugar, that releases insulin. And the more we do that, the more insulin the body releases. And over time, the fat tissues become tired of that insulin. So they become insulin resistant. And the body responds with releasing even more insulin, trying to counteract that insulin resistance. And insulin plays the key role in the fat metabolism. And insulin resistance will lead to weight gain. And then weight gain will lead to more insulin resistance. And you can soon see how this is a vicious circle, like a spiral that we need to try and break. So if you ask what can we do? What can we do against this? Well, the first thing is to acknowledge it. This is part of aging and part of the menopause, and that you are not alone. So it can be so frustrating. The strategies that used to work for you suddenly stop working. You think, is it me? Well, there's other women who experience exactly the same problems. So it's just understanding you are not alone in this. Next, we can, at Hormone Health, we have body fat analysis. So if you wanted to quantify how much fat you have gained, or to spin it in a positive way, how much you're losing if you manage to turn things around, we can see exactly where that fat is and if it's in the abdominal area or elsewhere. I believe, Sally, that next time you have this, you have Nigel Denby. He's one of my colleagues at Hormone Health. So he'll talk about diet and exercise in way more detail than me. But today, I think like a low glycemic index diet is helpful. It's shown to reduce that central fat accumulation. So what does that mean? That low glycemic index, they are foods that burn the carbohydrates slower. High glycemic index will blow it really fast and give you energy really quickly, but then it will drop.
Yeah.
So that's one thing that you could try. Exercise and especially weight training. For me, they're really important. They help with your mental health, but also really, really important for your health. And with weight training, there's one thing that I would like to point out, and that is if you build muscle, then you increase your basal metabolic rate. So what is that? That is the way how we burn energy at rest. So you don't even have to move. If you have more muscle, you will burn more calories. So I would, that's just one couple of things that you can try. And then thirdly, HRT, as you may know, Sally, partly prevents that central fat accumulation.
Fantastic, thank you. And I think that's a really important point to make around acknowledging that this is happening, because it's really hard and it's really, really frustrating. You think, but I'm doing everything I used to do, but I'm still putting on weight. And there's a massive frustration around that, and that recognition that this is part of the process we're going through, and we're not on our own, and it's very normal. But actually there are lots of things you can do. And also I know we've covered quite a lot of this in the sessions we've done with Jackie Lynch, and I know we've got St. Nigel coming, and I think that's then starting to really break down, well, what is it particularly we can do to improve that insulin resistance and allow our bodies to be able to process those foods. And you say, think about the foods that we're choosing. So that's fantastic. You mentioned as well about the impact of menopause on our bones and the risk around osteoporosis. So anything in particular we should be focusing on from a bone health point of view?
Okay, so osteoporosis, you will not notice, yeah, so it won't hurt, not like a frozen shoulder will hurt, but it will have an impact on the quality of life later on. So osteoporosis increases the risk of you having a fracture. It can make the difference of you being a fit 80-year-old versus someone who cannot get out of bed because they've just had a hip fracture. So again, there is a way of checking if you have osteoporosis, and that's a DEXA scan. So at Hormone Health, we have a DEXA scanner, and we can see how healthy your bones are, how dense they are. And we also have a blood test that can determine if you are currently losing bone mass. That's the cross labs. And we know that calcium and vitamin D, they are essential for maintaining a healthy bone. And equally, jumping is important. So somehow we just stop to jump. Like when we're younger, we just skip around everywhere. But if you manage to do skipping, for example, that impact of when you hit the ground actually motivates the bone to stay stronger. And then because we're talking about hormones, you know that estrogen helps to prevent a healthy bone. So that's dose dependent. So the more estrogen you have, the better the impact on the bone protection.
Fantastic, thank you. And I know as well a lot of similar things around the way what we eat and the foods that we have in our diet as well can really help massively with our general health, but also thinking about that bone health. And you mentioned in the introduction around the impact on the vagina and the vulva in terms of the body changes. Can you just talk about that in a little bit more detail as to what people might experience?
Okay, so with the vagina, often women say that the skin becomes thinner, like having your cervical smear test become painful, or even intercourse can become painful. And it's so easy to prevent that, what we call vulvovaginal atrophy. It's a pessary that soon will be available even without a prescription in the UK. It's a topical estrogen, and that maintains a healthy skin in the vagina.
And is that something people should be thinking about using when they have issues, or is it something people should be thinking about using? What kind of guidance is it? And is that something that we can talk to the GP about?
Absolutely, Sally. So I think the first step would be to recognize it and then put the two together. I am having, maybe I might be a bit drier, intercourse may be a bit harder, and just realizing this is happening, and then not being afraid to ask. Often in my work as a GP, I have seen ladies who've been suffering for years, and they didn't want to bring on that topic. So unless you ask them about dry vagina, they will not volunteer that information. Yeah. So if you're not being asked, then don't be afraid to say, well, I am experiencing issues of a dry vagina, or, the smear tests have become more painful. Please, can you prescribe me something for vulvovaginal atrophy?
Yeah. Fantastic. And just while we're on the subject of really going on to skin, we also hear a lot of people say their skins change in terms of feeling quite itchy and dry and thin. And again, what's causing that, and what can people do to try and manage that?
Okay, so as the hormone levels change, so we see in the menopause, we see a drop of estrogen, and that can have an impact on the skin, and it can accelerate the aging. So in the face, we see that the skin becomes thinner, and the skin becomes less elastic as well. So we see changes of the fat compartments, they shift down, and we see jowls happening or nasolabial folds. And as you say, the skin becomes itchy and drier. And that can just be uncomfortable in many ways. We know that sun damage can make us appear much older. So you see pigmentation and wrinkling. And if you want, I can give you some tips on how you can prevent these.
Yeah, I think if you could just cover a few top tips, I think that's always really appreciated.
Okay, so what I would say is number one is prevention. Yeah, so a really good SPF, so a sun lotion, and that doesn't have to feel thick. So the good sun lotions, they are thin and you don't even notice that you're wearing them. That prevents, the pigmentation and some loss of collagen and fine wrinkling. And equally, I would say next would be having a healthy lifestyle. So smoking and sugar, they are the main culprits of, changing the skin quality. So sugar will break down collagen as much as the smoking does. So if you can shift to a healthy lifestyle, you'll have less to fix because you prevent that aging, but it's never too late to start. And then HRT, so estrogen, will help with building more collagen, and it will help with making the skin thicker. And then what else can I recommend? Retinols, they are really good in reducing the pigmentation, and they reduce the size of the pores. They can help with fine lines. Maybe if you feel like adding another treatment, another serum, I would probably recommend vitamin C and E serum to your skincare routine, because that helps neutralize the free radicals in the skin. It's also preventative. But if it's only one that you want to do, then I would say sun protection.
Fantastic. And we'll make sure we write all this up for people. If people are madly scribbling down all those recommendations, we'll make sure we put that in an article for you. I'm conscious the chat and the Q&A is going really crazy, which is wonderful because I know people have got lots of questions to ask you. So I'm just going to ask my colleague Sarah from HEMPIC just to join me, just to start working our way through some of these key questions that are coming through. So Sarah, over to you.
Thank you. And thank you so much, everyone, for the sharing that's been going on in the chat. It's just phenomenal. So, Dr. Liz, you certainly hit a chord with a lot of people earlier on when you spoke about the menopause shoulder. There's lots of people who've been relating to that, sharing their stories on the effect of the ligaments and the tendons and the muscle aches. Is there anything they can do? Some people were saying they'd had a steroid injection, others have been seeing physios, but that's definitely a big theme that's coming out in the chat.
So yeah, that would be a good starting point. So, you know, speaking to your GP, seeing your physio, you can only have so many steroid injections during your life, so you can't use that as a permanent fix. I think it's about putting one and one together, and I have seen many patients improve with HRT. So they just suddenly say all their joint pain has gone. Obviously, joint pain, you cannot put it all into one basket. They can be due to wear and tear and just aging, but estrogen receptors are dotted all over the joints and the ligaments, and often HRT will improve it as well. So unless you have a contraindication, if you are going through the menopause, then that can be a consideration, and it has helped many.
Fantastic, thank you. And just touching on the HRT point there's been a lot of people that have been commenting, what if you cannot take HRT? You know, what would be the alternatives for people? Because someone's here saying, you know, look, I just can't take it. What would you suggest?
Okay, there will be some patients who cannot take HRT. So maybe they've had a breast cancer, or they have a contraindication to taking taking HRT, sorry. And first of all, I would always discuss this with a healthcare professional. So these are complex scenarios where I can't give a general recommendation. This is really complex, and some patients may decide to take HRT even if they're officially recommended not to, but this is above the remit of this webinar because I can't really explain the pros and cons in such a short time. But if you are not allowed to take HRT, there are other ways of treating vasomotor symptoms. There are, for example, some natural products like phytoestrogens. They can help a little bit, or you can try a product called female pollen. That's a pollen extract that has helped some women, in my experience, that cannot take HRT. You can try antidepressants. So you wouldn't take it at the dose of an antidepressant, but there is one antidepressant that you can discuss with your healthcare professional, a low dose that has helped with hot flushes. And there are other medicines like clonidine, but they can have side effects as well. So I can't make a general recommendation here because this is very individual, but do speak with your doctor, and there are alternatives available if you're not allowed.
Just very quickly on the joints and the joint pain, is there anything that we should be thinking about in terms of diet or vitamins and minerals that can help with that as well?
Yeah, there are some supplements, but I think I would need to double check. You know, it's always debatable how strong the evidence is of those supplements, whether or not they are effective in preventing the joint pain or not. So I wouldn't make a general recommendation here today, but healthy diet and, you know, being careful with your joints and keeping them mobile and exercising, certainly with a physio, for example, is beneficial.
Fantastic.
Super, thank you. And there was certainly a lot of sharing about what individuals do for exercise, and when you said about the weight training earlier as well, I think that was really helpful and sparked a lot of interest. But a couple of questions have come up regarding, can you regain your lost bone density? You know, is that something that you can get back?
Yes, absolutely. So when we do a DEXA scan, we see women who have, there are two grades of, losing your bone density. The first one is osteopenia, where you just have a mild bone loss, and then osteoporosis, where it is a little bit more severe. And you can see women recover from osteoporosis or osteopenia, and their bones getting stronger again. So that is very positive to follow. And you can monitor this with a DEXA scan.
Yeah, and I think it's that's, yeah, think about those practical things that you can do to start to improve those things. And yeah, and I think that's really important. I've also just seen questions coming up about collagen and the impact of collagen, and is this something we should be supplementing, or what does collagen do, and what part can it play in helping us manage some of these things? So
I'm guessing that the questioner is thinking about marine collagen. There are various forms of marine collagen that are currently on the market, and some of them are very expensive, and they gain increasing popularity. Now, I haven't seen firm evidence of oral collagen to actually be delivered to where you need it in the skin. And I'm only recommending things where I am absolutely certain that they are working. So for now, I cannot give a blank recommendation on marine collagen. I can say from personal experience, no, I haven't tried it myself, but some of my patients have, and like individuals have positively commented on it. But there is not enough evidence for me to make a standard recommendation for everybody, because those supplements are usually quite expensive.
Yeah, okay. Sarah, what other kinds of things have we got coming through?
Yeah, there was quite a theme earlier from quite a few people who were asking the question around, so it's related to your symptoms, and when do you actually know that, you know, you're in perimenopause or menopause, particularly if you've had a Mirena coil? And we hear this one a lot, Sally, don't we, in the sessions we run? But what would you share, Dr. Liz, on this one?
Well, it's tricky, and I would say even menopause experts sometimes realize it quite late. So how do we know, especially if the symptoms aren't typical hot flushes and night sweats, that what we are experiencing is the perimenopause? Because the perimenopause can start years before your periods become irregular, and the perimenopausal symptoms can start years before you have your first hot flush. So the mood symptoms and the sleeping difficulties, they're often first, or the joint pains. So it is raising awareness that I think is so important, that we are then able to link together that my symptom could be menopause related, and asking the question, is that caused by hormones, or is it caused by something else? But it is tricky. I do not have a recommendations other than be aware of the 40, 50 different symptoms that the menopause can cause, and then ask the question, could that be a menopausal symptom? Does that help?
Yeah, I think it is. I think we hear this a lot, don't we, Sarah? And I think it's the getting really specific about what's going on for you is so important, and we all know our own bodies and what's normal and what's not normal, and when we're starting season, and if we really keep a real clear track of those things, it can then help us to start to add things together and get a clear picture to then be able to discuss that with our GP or a menopause expert, to be able to talk that through, but it's very, very difficult to understand. So Sarah, we've got one last quick question that we can cover, because I'm conscious of time.
Yeah, probably our last one, Sally, would be around skin problems. So I know you've mentioned, Dr. Liz, about dry, itchy skin. You guys give some great tips around prevention and vitamin C and vitamin E serums. But quite a few people have said they've got itchy skin, particularly on their face, very red, very inflamed. What would you recommend for that?
Yeah, so again, we need to find out what is the reason for that, and that can be different for different people. So that would be a very individual consultation, I'm afraid. But dry skin cannot sometimes be accumulation of dead skin cells, and sometimes exfoliating with a medical treatment, for example, or you can buy some over the counter, that just brings up fresher skin cells. So what we sometimes falsely perceive as dry skin is actually dead skin that just wants to be peeled away to then have fresher, younger looking skin underneath.
Fantastic. Thank you very, very much. And thank you everyone for joining. I know there's a lot we've covered here today, and we are going to be sharing the recording, and we'll also be putting an article together which has got a lot of these top tips summarized, because I know it's lots and lots of information. And then as Dr. McCulloch said, we're going to be then continuing this conversation, looking at this from a nutrition and diet point of view on our next session. So thank you very much, Liz, for joining us. Really appreciate your time today. Thank you everyone for sharing, and thank you everyone for sharing the top tips and things that work for them and asking the amazing questions to come through. Thank you very much, Sarah.